morning, everyone. This is Sophie, and this is our future generation.
What is suicide?
Suicide is a complex and multifaceted issue with devastating consequences for individuals, families, and communities. It is defined as the act of intentionally causing one's own death, while suicide is often as a personal tragedy. It is also a significant public health concern, with global statistics highlighting its prevalence and impact. Suicide is leading cause of death worldwide, with more than 722,000 people dying by suicide each year. This translates to one death every 40 seconds. In the United States alone, suicide every 11 minutes. The true number of people affected is higher, as for every suicide death, there are who seriously consider suicide.
And contributing factors. While anyone can be at risk of suicide, certain factors can increase an individual's vulnerability. These include mental health conditions, depression, anxiety disorders, bipolar disorders, and post-traumatic stress disorders are strongly linked to suicide. Substance use disorders, alcohol and drug abuse can impair judgment, increase impulsivity, and worsen mental health symptoms, contributing to suicidal through behaviors. Previous suicide attempts, a history of suicide attempts, is a significant risk factor for future suicide. Social isolation and lack of support, feeling alone, disconnected and unsupported, can exacerbate feeling of hopelessness and despair, trauma and abuse. Experience of physical, sexual, or emotional abuse, bullying, or neglect can increase the risk of suicidal thoughts and behaviors. Financial and employment challenge, job loss, financial instability, and housing insecurity can create significant stress and contribute to suicidal ideation. Chronic pain and illness, living with chronic pain or a terminal illness can lead to feeling of despair, hopelessness, and a desire to end suffering. Preventing suicide. Suicide is preventable, and there are numerous strategies can be implemented to reduce its occurrence. These include promoting mental health awareness and reducing stigma, increasing public understanding mental health conditions. Reducing the stigma associated with seeking help can encourage individuals to reach out for support when they need it. Improving access to mental health care, ensuring that individuals have access to affordable quality mental health services, including crisis intervention therapy and medication, is crucial for addressing suicidal thoughts and behaviors. Gatekeeper training, educating individuals and various sectors such as educators, healthcare providers, and community members to recognize warning signs of suicide and intervene appropriately can help save lives. Restricting access to lethal means, limiting access to firearms, medications, and other methods commonly used in suicidal attempts can reduce impulsive acts. Responsible media, supporting promoting responsible media coverage of suicide, avoiding sensationalization and graphic details can help prevent copycat suicides and reduce the risk of contagion. Building supportive relationships, fostering strong social connections, promoting healthy communications, and encouraging individuals to reach out for help when they are struggling can create a more supportive environment. Seeking help. If you or someone you know is experiencing suicidal thoughts or behaviors, it is essential to seek help immediately. There are numerous resources available.
What is anxiety and stress? Anxiety and stress are both common human experiences, but they differ in their nature and causes. Stress is a response to a perceived threat or demand triggering physical and mental changes to cope. It can be caused by various factors, including work pressure, financial worries, or relationship problems. Anxiety is a feeling of worry, nervousness, or unease, often associated with anticipation or fear. It can be a normal response to a stressful situation, but when it becomes excessive or persistent, it can become a mental health condition. In summary, stress is a response to a situation, while anxiety is a feeling that can be triggered by stress or other factors. Both can have significant impacts on our physical and mental well-being.
In our generation, we both say that most of our generation suffer anxiety, stress, and trauma. And because of this feeling, they commit suicide as a young generation. We have to be open to our parents, even to our closest friends, especially to our Almighty God. We need to be positive even we struggle in life. Not all people can understand or relate to us, but we have to think about our good future. Suicide is not the answer or good answer if we suffer from that sickness. So if you feel bad, choose to be open-minded and choose the best comfort zone. If we have a friend who suffer hurt or failure, try to comfort him here. We give some advice, cheer here up to boost his her confidence in recovering from what she is going through. Minimize also using any platforms such as Facebook, Instagram, Twitter, and TikTok, because it may also affect us to bad habit, and not all can have a positive impact on us. Anxiety is not a joke, yet suicide is not the answer. Stress is not a joke either, but again, suicide is not the weight over what we undergo.
Suicide is a complex strategy with far-reaching consequences. While there are numerous factors that can contribute to suicidal thoughts and behaviors, it is important to remember that suicide is preventable by promoting mental health awareness, reducing stigma, improving access to care, and fostering supportive relationships. We can work together to create a society where individuals feel empowered to seek help and where suicide is no longer acceptable solution to life's challenges.